So this is what your foot might look like if you have posterior tibial tendon disorder, stage 2 or 3, and are considering reconstructive surgery. I had tried a soft nylon lace-up brace with Velcro straps and a rigid arch supporting orthotic and supportive shoes, and that worked for a while. Then I got a Ritchie-type brace. This is the molded thermoplastic version with an arch support molded right in that I used, and it seemed to work for a while. Here you can see how much atrophy of the calf muscles I have from wearing the brace all the time. This is about 5 weeks with the brace. Anyway, it got worse. I decided enough is enough, and I'm going to have surgery. So in my case, the surgery that I had was a medial calcaneal displacement osteotomy, lateral column lengthening, also known as an Evans osteotomy, and in my case with a titanium wedge, a medial column lengthening, and in my case with a titanium wedge. This is also known as a cotton osteotomy or a cuneiform osteotomy. I also had flexor digitorum longus tendon transfer or replacement of the posterior tibial tendon, and the posterior tibial tendon was removed. I also had a gastrocnemius recession. The whole procedure took about 3 hours. It was done under general anesthesia with a preoperative nerve block. So when you get out of surgery, your foot is in a splint. It's wrapped in a thick layer of fluffy dressing, and there's a plaster half cast or splint along the back of your leg and under your foot. And it's open in the front and wrapped in an elastic bandage because your leg is going to swell a lot over the next couple days. They send you home with a big foam wedge like this. And the most important thing you can do for the next 8 weeks is to keep your leg elevated and don't walk on it. The hospital sent me home with a pair of crutches, and insurance also covered a knee scooter, which I got from a durable medical equipment supplier. I also borrowed a bedside commode, really only ended up using the commode as a shower chair. I also had a marvelous nerve block. Here is the catheter, and it goes into the outside of my leg. Here's the pump, and it pumped a little local anesthetic like Novocaine through the tube and onto the nerve that carried the pain impulses from my foot. If you need an extra dose every now and then because it's starting to hurt, you can press the button and it gives you an extra dose from this big bag of anesthetic solution. My nerve block lasted 5 days, and I had virtually no pain the entire time. I didn't have to press the button. I did get a script for Vicodin as well, which I didn't need. I took 4 of the Vicodin because I was afraid it might start hurting. It never did. And because I was having trouble sleeping on my back with my foot up. The most uncomfortable sensation the first 5 days was like it was being stung by a million teeny tiny bees. It just had an electrical buzzing sensation all over. And occasionally I got a very sharp, intense heel pain that lasted 5 or 10 seconds at the most. I would gladly have traded the whole bottle of Vicodin for 5 Ambien because sleep was challenging the first couple days. After 5 days, I pulled out the catheter when the anesthetic ran out from the bag, and I mailed the pump back and threw out the bag and the catheter. After 2 weeks, I went back to the doctor. They took off the splint, and you can see I was having some trouble with athlete's foot and was spraying athlete's foot spray inside the splint. You can see how bruised and swollen my foot still is after 2. I was surprised how bad the swelling still was because I could tell that my foot was getting less and less swollen. It could move around a lot more in the splint. You can also see how atrophied my calf is in just 3 weeks. They did x-rays, they took out the sutures, and they put on a cast. I spent another 6 weeks in a cast, non-weight bearing, and still needed to keep it elevated as much as possible during the day. A trip in the car longer than 30 to 45 minutes was uncomfortable because my leg would dangle and start to swell. I'd have a rare, sharp heel pain, and I had a lot of restless leg symptoms in my surgical foot in the evening in the cast. I could exercise my foot by squeezing the muscles in my foot and ankle and lifting and pressing down my foot and toes in the cast. I thought I would be able to do more around the house in the cast, but I still needed my hands to operate the scooter or the crutches. I was surprised how easily I could get up and down the stairs with the crutches, but my husband always spotted me. My husband did have to do virtually everything around the house, including help me up and down the stairs and in and out of the shower. I could not get any pants on over the cast. Some people, better patients than I am, do chair aerobics and chair strength exercises at this point. 8 weeks post-op, the cast came off, and I got a cam boot. I went the day before my appointment to the durable medical equipment provider. I got fitted and picked up my boot and took it with me to the appointment. More x-rays at this visit. When the cast first came off, it felt like there was a tight band around my foot and ankle. Areas of my foot and ankle were quite numb. Because of the cast, 8 weeks of dead skin were still clinging to my foot and leg. I was warned not to scratch it or peel it off. I rubbed it off gently over the next 2 days in the shower. I was told to wear the cam boot whenever I was standing, walking, except in the shower. And I could start physical therapy, but no inversion or eversion exercises or balance exercises yet, and to continue to use crutches for the first week in the cam boot. When sitting, I took the boot off and elevated my foot and started some physical therapy at home. I decided to wait on formal physical therapy at the clinic until I was out of the boot. As you can see, I can curl my second toe even after the flexor digitorum longus was used to replace the posterior tibial tendon. I definitely have a left arch in my foot now, and I've been using the stationary pedal machine, walking in the pool, and swimming, as well as walking the dogs for the last 3 weeks in the cam boot. I was much more independent in the cam boot, but because I didn't do those chair aerobics, I had lost a surprising amount of strength in my knees and hips. Walking upstairs was tiring to my hip, and the unevenness of my leg in the cam boot also bothered my hip. I tried making a shoe leveler. It was okay, but you might want to order one from Amazon. I also started wearing a 20 to 30 millimeter tightness elastic stocking all day during the day and as much as I could stand it at night to help reduce the swelling in my foot. In about 1 week, I go back to the doctor's office and he'll do x-rays and hopefully give me the go-ahead to stop using the cam boot, and I will be able to wear 2 normal shoes.